Good morning, everyone. Gavin here from Chinese Medicine Education and China Book Sydney. I'm here today with the lovely Sonia Tan. So, for those of you who don't know Sonia, she is one of the very few gold level certified practitioners of the late Dr. Richard Tan, who I'm sure a lot of you are already familiar with Richard Tan. So we're very lucky to have Sonia sharing her expertise today. And we've had Sonia come out and teach classes with us several times now, and every time the feedback is always fantastic. One thing that's really great about Sonia is she's not only an amazing practitioner who really embodies everything that she's teaching, is that she's also an amazing teacher as well, which I think is it's a rare combination to actually find a good practitioner and a good teacher who can convey those methods. And everyone always really appreciates how hands-on the workshops are that we do with Sonia, and how much information she's able to share. She's not only a practitioner of Chinese medicine and acupuncture, she's also steeped in the arts of traditional methods such as face diagnosis, astrology, feng shui, martial arts. So she really walks the talk. So we'll be hosting Sonia later this year. So mark in your calendars, Saturday the 8th to Monday the 10th. Sonia's going to be coming and doing levels 1 and 2 of the balance system. And I'll let Sonia sort of expand a little bit more on what will be covered in that workshop. But yeah, it's we've run this course before, and it's an amazing opportunity to get a solid foundation in the system. And Sonia's always very hands-on and practical. She'll have like some teaching assistants so that everyone has the chance to actually not only get shown the points, but actually feel and start needling and do all the practical stuff, which is so important with this kind of thing. So that'll be Saturday the 8th to Monday the 10th of November. And if you have any questions come up about that, you feel free to ask during this presentation. If you do have any questions, pop them in the chat box, and I'll be fielding them for Sonia as we go along. So the presentation today will be roughly an hour, and yeah, I'll hand it over to Sonia. Thanks, Sonia.
Thank you. Thank you very much. I'm very honored to be here and to continue to pass on this knowledge. Obviously people are curious about it, and was telling Gavin, one of the challenges about giving a little introduction to balance system acupuncture is that because it isn't TCM acupuncture, it is classical acupuncture. I have to kind of give you the context. You can't just use what you learned in school and then apply it. I have to kind of give you the context. And that's really what the foundations are. It's giving you the foundations of the alphabet and the language of this classical style of acupuncture. And then hit the ground running in your practice with quick, instant results with when you apply it. So the intention today is just to give you a peek into what this is and what the results are. And then hopefully I'll see you in November. So let me start off with sharing my screen here. So since Gavin gave me a wonderful introduction of a little bit of my lineage and then my connection to Dasha Tan as one of his gold level practitioners, also one of his senior 16 students, which are two different things. And gold level was his way of giving someone the top acknowledgement of training and knowledge, but also his intention over time, over the course of his time, was for them to teach. And I do have the blessings of the senior 16 students to teach, and you'll see those blessings in my book that I know that China Book Sydney also has as well, which is actually a handbook of all of the reference diagrams and notes, reference notes that you would need for the foundations course. So we strongly recommend you have it. That was created out of me teaching this over time. So a little bit of my lineage, Gavin touched on, I have a family history in Chinese medicine. I'm also trained in all of the wushu, that's the 5 arts, sometimes called the 5 branches. And I definitely am going to go back to here, just paying respects to all of that, because I believe that we stand here because of all the knowledge that came before us. So I always like to acknowledge all of my teachers and the giants and the elders of classical Chinese medicine before us, because otherwise we would not be here. So I always like to say that in the beginning. Thank you to that. So going quickly to here, because we only have 1 hour, is a little bit about the history. The name has been a little bit misunderstood. Some people call it Tan balance method, Richard Tan method. And the reason why I have this here is because I wanted to emphasize that it is not just one person's work. It is classical acupuncture. It's from the classical books. Dr. Chao Chen was the first person that wrote about the connection of acupuncture and the I Ching. That book was published in the 1970s, and that is still drawing from the classic references. Wei Qiyang, who is a student of Master Tong, he added in or has references of classics, the classics reference to holography. We're going to talk about what that is because that is a context or a map in how you're going to choose point location. And so he was a student of Master Tong, and Master Tong's points are incorporated, a lot of them are incorporated into this system, which Dasha Tan, I say Dasha, as Dasha means grandmaster in Mandarin, and that refers to Richard Tan. He incorporated into strategies that we use in the Balance System Foundation. So Dasha Tan really took this and created these strategies within it, but most of the content is actually from the classics. So it really is better to just attribute it to just to say balance system or balance method acupuncture, so that you're acknowledging the others before us. So like I had mentioned, we're gonna just tease into one concept in the single balance level 1 and one concept in multiple balance. And then we're going to go through a couple cases and see what questions you might have as to why you're here. So with that, why don't we get started? If I can get my slide moved, here we go. So I touched on this earlier. What is holography? So this is from the classics. It's from the theory of the Tai Chi and Yuan Qi from the I Ching or the I Ching, depending on if you if you like to pronounce it in Mandarin or not. And so this is referenced from Wei Qiyang, and it's technically called in the classics Ting Ying Chuan Shi, tissue correspondent or an echo, holographic or whole information model. This is referenced also in the Huangdi Neijing. This is important to understand this because basically you're translating, we're looking at the translation as a complete message or a whole information or a holography. Also, some people call it a microsystem, but it's a holographic image of a body part or part of the body. This reference in the classics references a bigger, deeper Taoist philosophical understanding of the body that references the heaven and the earth and humankind in the middle. The Taoist and Confucian scholars have said this: man exists in the universe. And that literally is, we exist in the universe, heaven above us, earth below us. But the Taoists also say the universe exists in man or humans. So for that some people don't really quite understand what that is. And that is where the beauty of classical acupuncture really showcases this Taoist concept. Now, this is just a teaser today. When you take the whole course, you're going to understand, the big picture. You're going to have that, light bulb moment, which is always fun to see. But right now, we're going to touch on this Sansai concept. Between heaven and earth, there is humankind. And this applies not just to, the universe exists in the body and how we use acupuncture, but this also exists in a bigger picture. How do we live in harmony with the world? How do we live in harmony with the cycles of time or DNA that's predetermined for us, or astrology? But then we have the influence of people and medicine, and also we are absorbing the environment around us that influences us. These are bigger concepts, which is part of my passion, my upbringing that I teach. But this concept definitely exists in classical acupuncture if you dive in, if you can see that, and you have a way to kind of guide yourself into, because TCM acupuncture doesn't have this concept. So that's what this is referring to. So this is an extension of the concept of holography. This humans exist in the universe and universe exists in humans. This sansai is an extension of this holography. And I hope to illustrate this in the glance today, but it's definitely something we go over in level one, in the level one of foundations. So going back to holography, many areas of Chinese medicine and other East Asian countries actually use this concept of Chuan Qi for short. In Vietnamese medicine, this is what it's called. I do not know how to pronounce it, so that is it there if you know it. And other examples also include auricular acupuncture. Everybody's learned that in school. Korean hand, foot reflexology. You actually understand microsystems. The true name is Chuanqi, Tingying Chuanqi, or holography. That's what we're talking about. We have a picture of the universal energy in the part of our body. It exists in humans. The universe exists in humans. So you can see that's what we're getting at. So in balance system acupuncture, there are a lot of different holography maps that we use. Here's one here that's in my book. And we use those as a way to guide us as to our acupoint location based on the channel that we're choosing to balance. Okay, so let me get to that now. What do you mean channel we're choosing to balance? Because when I went to school, I learned TCM acupuncture. Isn't that the only kind of acupuncture out there? No. In fact, TCM acupuncture was developed in the 1950s, the one homogeneous, unified way to diagnose and apply acupuncture. But prior to the 1950s, classical acupuncture was channel based. So acupuncture or channel theory based. Okay, and that's the original way it was applied. What we learned in school in terms of diagnosing a Zongfu diagnosis, that's actually for herbal applications. But they kind of applied it or switched or found a way to try to use that in an acupuncture way, I guess to make a more simplistic system. In fact, I think it's actually simpler if you go back to the classics. So I love this cartoon, which I had permission because for those of you that know Balance Acupuncture, I think I saw one student I recognize in the audience today that you would know actually this area actually will treat the neck. So I think that was a brilliant illustration. So what do I mean by a channel theory or acupuncture diagnosis? Well, the concept is you have to move away from TCM acupuncture. You have to start looking at channels, and you have to remember this big concept that is in the classics, and it's in this very old, one of the oldest Taoist classics called the Zan Tong Qi. And in this, it references Li Gan Zhan Ying. This reference means that if you are practicing the alchemy of the medicine correctly, then you are able to establish heaven on earth in the body. And that beauty of that perfect balance, you immediately see the shadow. That means you immediately see the effect. You have immediate results. I think that that's possibly mind-blowing for many of you, maybe after school. So that's where I love teaching this because I would say it's a game changer for you to have that instant feedback, your patients to get that result. So this is what we're talking about. All channel theory, in fact, even from Master Yuan and his work, you should have fairly quick, efficacious results. Very quick. From this Taoist concept, Li Gan Zhan Ying. So that's you switching your brain to go to channel theory. So balance system is a part of channel theory. It is also part of classical Chinese medicine instead of traditional Chinese medicine, which I think traditional Chinese medicine is more like modern Chinese medicine. So it's part of classical Chinese medicine or classical acupuncture. So first in the classics and refined by Dasha Richard Tan. So what you need to first remember when you are trying to utilize this system is you have to change your brain and look at what channel is sick and needs to be remolded. You need to take your Zongfu hat off. You almost need to forget what you learned in school. And you just need to look at, okay, that area that's blocked or sick, what are the channels that are flowing through that area? Those ones are blocked, and those are the ones that need to get unblocked, tissue healing restored, sending a healing response, triggering it to go back to homeostasis. So That's what we're going to look at a little bit today. So getting started today, I'm going to introduce some concept, introduce you one system. We'll go through a little case here. So it all starts here with the Wuji. Going back to lay the foundations. The Wuji is where that's the limitless. There's no boundaries in the universe. This is the universe at its beginning, the very beginning of the state of the universe. And then the elders figured out, okay, hold on, there might be no boundaries in the universe, but the world actually has limits and boundaries. And that's the Taiji concept. Those limits and boundaries have a binary relationship. That's yin and yang, something you've learned a lot in school. So this is the great limit, where this is no limit here. So this binary system is what the elders use to understand the phenomenon of the world, which I know you've learned a little bit in school. So I'm going to start to change my screen here and show you a little bit about what this actually means. So if we have the Wu Ji here, and it understood that there is a binary relationship, the binary relationship of yang and yin. Yin is represented by a single line, yang is represented by a one solid bar or yao line. This is called a yao line. And if you have an imaginary line in the middle, the elders knew, okay, in order for the world exists in order to try to achieve balance. It's always wanting to achieve balance. How many dimensions and phenomena in the world are there that also need to establish balance? So on this yang side, we know that this could be split into two other further relationships or dimensions, but still have balance. You could have yang, then yin, yang, then yin. That's still balance, correct? Right? Because we have one yang here, one yin, one yang, one yin. So on equal side of this dividing line, it's still balance. Agree with me? I hope you're nodding because I can only see part of you. Okay, so then we have another relationship the elders saw. We could have two yang lines on this side, and we could have two yin lines on the other side. So now, if we clear up this here, is it still balanced? It is still balanced. Two yangs, two yins, it's still balanced. Either side is still balanced. So this is creating a dimension or relationship that still creates balance, but understands there's different phenomenon in the world. So if we were to look at this a little bit more in a microscope, if you look at these two here, do you see how I have two yang lines here? Two yang lines means the greatest amount of yang. And over here, do you see how I have two yin lines here? That means I have the greatest amount of yin. Tai meaning the greatest or grand. And over here in the middle, okay, this is on the yang side, but it's got a little bit of yin. It's not pure yang. Oh, it's lesser yang, shao yang. Same goes on this side here. We have a yin bar, but it's got a yang bar. It's not pure yin. So it's shao yin, lesser yin. Any of these names sound familiar to you? I sure hope so, because they should sound like the channel names. So I'm going to break it down a little bit further here because the elders saw that there were still further dimensions to this, that it could be broken down for the final 8. So first of all, we have, oops, sorry. I just touched something here. Yang, then yin. Yang, then yin. Yang, then yin. Yang, then yin. Still balanced, equal, each side, right? Good. Then we have yang, two yangs, then two yins. Two yangs, then two yins. Still balanced, equal, each side, correct? Now, finally, we have 4 yangs and then 4 yins. Still balanced, each side, correct? Perfect. So what you end up having now is you have the final eight. You have this final eight that are represented right here. And if we're looking at the final eight, first of all, we have the assignment of the phenomenon from the elders. We're not going to get into that today for sure. We have the assignment of the wuxing, the five behaviors. We're not getting into that today. Those assignments never change throughout the history of the I Ching. The assignment of the channels did change over the course of 3,000 years, but in this first iteration, probably the oldest one, this one is dated to about 2,000 years ago, this was the assignment of the channels to the I Ching. Now let me change my color here. Du is here. Does du make sense? Oh, three yang, ultimate yang. What channel is most exposed to the sun if you walk on all fours like an animal in the animal kingdom? What channel? Du channel is most exposed to the sun. So it is the most superficial and it is the most amount of yang. Remember, this is the yang side and this is the yin side here. So over here we have Ren. Okay, well look, this is the most amount of yin. That's the least exposed to the sun. Remember, animal walking on all fours in the animal kingdom. Ren is a very midline. It is the least exposed to the sun. Does that make sense? I hope so, because what this is illustrating here over 2,000 years ago is the layers of the channels and exposure to the sun. So I'm not going to get into why they assign these to these I Ching channels. But what I will say is that it is connected this way because of a rule. There's a rule with any I Ching Gua that it wants to always find its exact opposite. So if we take this and we go like this, okay, but then we take this and we look at side by side, look, they are the exact opposite Gua, aren't they? The rule of I Ching law is that it always wants to find its exact opposite to establish balance because it wants to create balance in the world. So it's trying to find its opposite. That means that this gua is trying to find the opposite gua in order to establish balance. So let me just clear this out for a moment here so you can see this again. So if you can just focus here on the yellow line, they are connected by the I Ching. It's a sign that has a magnetic polarity to its opposite, but they have a common layer or pathway to get to each other. You've probably seen these names before. Hey, those are your channel names, and they also refer to the layer of the body. Let's remember that hand tie-in connects to foot tie-in. They lie in the exact same layer of the body. So they have an affinity or connection to each other, and this is where it comes from. This one from over 2,000 years ago that the elders figured out they have a connection based on the assignment or the chemistry of the channel. So the system one here, Ming, same channel name, is because of this I Ching connection, and it's the layers of the channel. So just think of exposure to the sun. That's how they're connected to each other. You memorize all this in school, the names. You get to use it. Okay? You actually should remember the channel names in System 1 because that's the original name and there's a connection. It wants to find its opposite channel name to create balance. The rule, if you're using System 1 to create a balance, is you must use it on the contralateral side. You must choose the balancing channel on the contralateral side because this is like a switch, like the brain, right? It's trying to go to the opposite side. Opposite side. So it's like the brain switching to create balance. That's what System 1 is doing to create balance. So there is a rule. And it's important to know the rules or you just won't be effective. So if we think about that, this is one of the easiest ones to get started with because you should know the channel names, right? You should know the channel names. You should remember if it's hand or foot. And now you just need to know the rules, contralateral treatment, and how do I get there? How do I diagnose? How do I choose that? Well, one of the easiest ways is this five-step approach. And one of the five-step approach is, I'm going to just write it out here, is number one, you have to diagnose by channel theory. All right? So if you chose that, say, spleen channel is sick or blocked, okay? Someone comes in with a leg injury. So in level one single balance is primarily used for MSK, musculoskeletal conditions. Level two is for internal medicine. So they come in with an injury. Maybe they have like a tendon injury on the inside part of their tibia. Then your second step is what is the balancing channel? What is the balancing channel? Well, if you write out the full name, this is foot tie-in. So in one, system one, this is Ming. Chinese original name is Ming. Only Sonia Tan gave a number so we can memorize it's a contralateral rule. Okay, so the balancing channel is the channel of the same name. Okay, that means it's tie-in, but you have to switch to limb. You go to hand, and you go to the contralateral side. Oh, okay. Hand tie-in is lung. Easy. And then I go to the opposite limb. Easy. Okay. What's next? Where do I go? Acupoints. That's what's next. So the next point is choosing your points. And this is where you need to understand the holography. This gives you the roadmap of what or where you want to go. So I'm going to flip back to my PowerPoint here because I have some diagrams of the holography. I think that's popping up there now. Thank you, Gavin. Good. All right, so here are some common diagrams of holography that we use in balance acupuncture. So this one over here, this one is called puppet show because it looks like a puppet. Here's the eyes where the MCP joint is, so the nose is here and the mouth. That's the corresponding image. And we talked about corresponding image, tinging, tuanqi, microsystems, all that. And therefore this is the neck. And we have the pivot point of the elbow and the umbilicus. And there's a reference in one of the classics that says everything starts at the umbilicus and extends out. That's the pivot point. And then over on this side here, we have direct imaging, meaning upright. So the deltoid is now the face. And then we have the upper torso. We still have the pivot point of the elbow. And then we have the lower arm is the lower abdomen. Look at the lower arm in both cases. The lower arm treats the upper torso, but it also treats the lower abdomen, which means that the lower arm and the lower legs actually treat the whole body. It's no surprise that the 5 shu transporting points are so powerful. And you can so that's why balance system acupuncture is so effective in community. Just roll up your pants and on our sleeves and we can treat everything. So here's some other images. We can use the whole head for the whole face. So the whole arm and leg can represent the whole face and you can flip that. That gives you a wider target area to work with. If someone says they have a headache and their headache is right here, by the way, what channel is that? Look at channel, not your Zongfu. Then I can use this whole area here to treat it instead of going back here and using this tiny image for a headache. So you want to use a large image if possible. Okay, so here are some other common areas of holography that we use that we would be covering in the first level of foundations. So let's look at a little case now. Okay, because and I know you've learned this. Here's ones you've learned in school. So here's Korean hand and here's auricular. But let's look at a little bit of a case now. Let me just change it here. So we're diagnosing by
No,
channel.
Sonia, you
Yep.
wanted to know when we're roughly halfway. We're roughly half an hour in, but feel free to just like go. Like we're not restricted on time. If anyone needs to leave, they can leave. This is being
Okay.
recorded, so we'll put it up for everyone later on.
Okay, good. Because I haven't even gotten to a level two
Yeah,
glance
yeah, yeah.
yet.
You
So,
go, you
okay,
go.
here we go. Here we go. Are you got your seatbelts on? All right, let's go. So, first step, channel theory. We talked about balancing a channel. You're going to choose your point by holography. And I added two other steps. You'll learn why in the class as to why I added those two, adding to dash of 10. So here is an example. So of just a single balance, level 1. Chief complaint, this is a real case. I always give real cases. Male patient age 55 with right side tennis elbow pain, 7 out of 10 daily pain. So it's lateral epicondylitis. I don't know if it's common in Australia, but in North America, pickleball is the rage. So this person is got this pain from playing pickleball, and they have pain picking up mugs and drinking. So pain with internal rotation, all that, all the classic tennis elbow pain, and it has been going on for 2 months, impeding daily life. Started after a new paddle, but it was already there before that. Patient usually pays 3 to 4 times a week. Well, quite a lot, has had to reduce it, and it's affecting his moods. So on palpation, you feel that thickening and soreness, and it's on the lateral epicondyle, almost directly on the bone, anterior and posterior to the radial head. 8 out of 10 with palpation, 7 out of 10 daily. You do your 10 questions, you do your other history. It's all good. So if you were to look at your channel diagnosis, and I know we're short on time, and I was gonna kind of have you guys interact with me. Since we're short on time, I'm gonna go here, and you're gonna see on the lateral epicondyle, almost direct on the bone. I want you to think, what's the channel diagnosis? What channel is blocked? Because I know you're probably like, oh, is it liver qi stagnation? Or maybe it's spleen qi deficiency because they're deficient. That's TCM Zongfu diagnosis for herbs, okay? Look at the channel. So if we look at the channel, it's kind of on LI channel, but it's kind of going toward Sanjiao channel. Would you agree? Okay, everybody should know your anatomy. It's mostly here, but it's going towards Sanjiao channel. So if we're using system 1, Ming, we're just using the channel of the same name to balance this. This is hand Yongming. That means I have to use foot Yongming to balance it. Oh, I know that. That's stomach. And here, Sanjiao, we know that's hand. Shaoyan. Oh, good. I know I need to use foot. Shaoyang, sorry. Shaoyang to balance it. Okay, that's GB. And I have to remember this rule. It has to be contralateral treatment only. Perfect. So since they said it was right side pain, that means I need to go to left side stomach and left side GB. I know your patients will have fun with this when you're like, why are you going to my knee? But that's what you're going to do. And then the holography guides your way. So I'm going to go back to the holography. Let's go back to a little map here. And we're going to look at this one here. Oops. Here, where we have the arm can represent the leg. So if they have this pain here, you're going to be going just distal to the knee. That means I'm going to probably palpate around stomach 36, but I want to make my way towards GB 34. And I actually want to palpate anterior and posterior to the bone here, because that also represents the bone at the elbow here. And usually you'll find a thickening or a soreness, and you're going to needle right in there. You can needle those 2 points purely, but you also want to needle in between because the problem is in between. And you should always have instant results right on the table. So the pain should reduce by at least 50%. The tissue should change under your fingers by at least 50%. Not just pain, discomfort, tightness, thickening, all of that. So I'm going to go back and over here, and I was going to say something's changed. It's still there. Oh, but it's moved. And I'm going to tell you movement is good. Stuckness is not. I'm not going to do this follow-up, but I'm going to definitely tell you that the pain reduced on the tissue and the thickening reduced right on the table. Just because we're short on time, I want to just scoot over to level 2 in the multiple system balance. But maybe what I'll do is I'll just pause here for a moment because this is just about at the end of my single system glance, and I just wanted to see if there are any clarification questions we can do before we go into next level up.
All right, so yeah, if anyone has any questions, you can either pop them in the chat box or put up your hand or just unmute yourself and ask. Otherwise, we'll keep on going. Any questions? No?
Sometimes it seems too easy in the beginning. I'm like, okay, sure, I'll just use the same name and do contralateral side and I'll just go on the copy the image. And it is. It can be. Especially when in level 1, you're going to learn 5 different strategies, not just Ming system 1. So where it gets complicated is that, okay, how many times do you ever get someone that just has one channel wrong? I mean, if they're coming in purely for just musculoskeletal, yeah. But how many times in clinic do you also have, oh, I have problems with constipation. I have problems regulating my menstruation. I have many, many channels that are blocked. So that's where we get into level 2. And level 2, after you learn the five strategies, is where you start to put a language together, a really deep layered strategy. And you would want to use this when you have a couple things or 3 conditions. Number 1, what do you do if pain is everywhere on more than one channel or more than one area of the channel? It's on the whole channel. They're saying, yeah, I get temporal headaches and I get upper tract pain. I also have really tight IT bands and something's wrong with my peroneals. The whole gallbladder channel is blocked. Or they might say pain is on 2 or more channels, or that you've noticed it's on many, many channels. And how am I going to do that efficiently other than doing one for one? Or it's a functional or internal medicine problem, which I just discussed. If those 3 are present, not all 3 need to be present, then you need to start to consider a multiple system balancing strategy, also called global system balancing strategy. In order to establish or do this, there are 2 requirements that are needed. This is something that Chao Chen and Dasha Tan had figured out. Number 1 is you need something called a dynamic balance. This is to establish yin-yang flow and circulation. Circulation is so important so we can get resources everywhere. Number 2 is a static balance. This is a truss or an engineering design. Both Chao Chen and Dasha Tan were civil engineers. They understood this concept well. And the truss design is created when you know the 5 systems and how they connect the circuitry together. This is what they look like, a dynamic balance. So you're going to choose yang channel points, yin channel points, yang channel, yin channel points, yang channel points. But you can see that it's circulating clockwise and counterclockwise. It's still alternating between yin and yang. Because in natural law, it alternates between yin and yang. It doesn't go yang yang to yin yin. So this is establishing circulation according to natural law through the whole body. On the right side here, we have the truss. This is the engineering design you see in civil engineering design that establish a strong, long-lasting foundation. The way that these connect are by the relationships of the 5 systems from level 1 single balance that create a circuitry, a pathway, a connection to each other. And then it creates a very strong, long-lasting foundation. I'm going to tell you, cutting to the chase, that if you use the pre-designed strategies that Dasha Tan had created, you should always have the truss. If you miss a channel somehow, you might not have it. You might have broken the dynamic balance. You might have broken the static balance. So just knowing just knowing that you're using a pre-designed strategy, you will have this. But when I teach it, I teach you how to understand how it's put together. Should you need to adjust, should you need to recognize, hey, I didn't set it up right. Because I'm trying to give you the tools to fish. I'm just not, don't want to just teach you how to fish. Because if you have the tools and know how, you'll be able to adjust in the future. So, before I want to show you this case, I want to give you an example of a fairly easy strategy that we use for nausea, vomiting, any cardiopulmonary problem. If you were to put one hand on your chest here, you know when people say, oh, I have acid reflux, or they put one hand and they say, oh, I have nausea. So if you look at the width of one hand, the width of one hand at your midline is going to encompass ren, kidney, and stomach channels. So this width of one hand is only as wide as stomach channel. This strategy for anything cardio, pulmonary, so I said reflux, right? We could say cough, chest pain, nausea, all of that. Where do people put their hand? Over top, ren, kidney, stomach. This strategy is called magic for midline. It's also called the one-handed approach, magic for one hand. It's also called the narrow front. The narrow front. So if we're trying to establish a balance, so let me use a new page here. With the midline, maybe they're nauseous, maybe they're having some morning sickness here, okay? And so we know ren, we have kidney, we have stomach, kidney, ren. This is what we're trying to balance. So I'm going to give you the cheat sheet here. I'm going to give you the fast forward. If we were trying to focus on the abdomen here, and I know, remember I told you that the elbow and the knee are level with the umbilicus, then that means in holography, any point that is near the elbow and the knee is going to image around the abdomen. So for nausea, for example. Oh, do you remember learning that in school? The C point is really good for all abdominal disorders. Well, that comes from the classics and it comes from holography. Okay, so technically I could use, for example, we're going to have stomach here. Let's have kidney here. And we'll have PC here. And we have LI here. Do I have yin-yang flow? Do I have yin-yang flow? Can you check? Do I have yin-yang flow? Have I alternated yin-yang, yin-yang? Let me see a nod. I can only see Gavin right now, so thank you, Gavin. Okay, and then I'm going to cheat sheet. I'm going to tell you this is how they connect. PC connects to kidney. LI connects to stomach, but that one you learn by Ming, System 1, Yang Ming to Yang Ming. PC connects to stomach. LI connects to kidney. If you want to know the whys, you have to take level 2 because I can't explain to you now. But here, do you see that truss? This truss, this bow tie truss has been connected. Oh, so beautiful. You have a dynamic balance and a static balance. Now all I need are the holography points. Okay, let's focus on the abdomen for this person that has nausea. Okay, near the abdomen would be, okay, 36. Yep. I could do kidney 10. I could actually do 9.75. I don't have to do right at the knee because they're probably not complaining that their nausea is right at the umbilicus, are they? No, they're saying it's above the umbilicus. Okay, above the umbilicus, 9.75. I'm going to show you on the holography what that looks like. That means LI, I could do LI 10. I'm not going to do LI 11 because they didn't say their nausea was at the umbilicus. It's just above it. And then PC, okay, let's do 3.25. Same concept. This is something called an attack, attacking the image of the stomach. So let's go back to the holography here, and I'm going to change my share screen so you can see this because I just remembered I had another one popped up here. All right, so here I chose to do LI 10. Oh, look, is that not the image, the location of the stomach? Great, I chose to do PC 3.25. Great, that's perfect. This person's complaining of nausea. And like I said, maybe it's a female complaining of morning sickness. Okay, 36. Oh, but 36 is here. Oh, abdomen, nausea. Great. Kidney, 9.75. 9.75. Kidney. Perfect. Nausea. OMG. How great is that? Because it's so direct, it's so focused, so clear. The body can't help but get better because the message is really, really clear. That is magic for midline. That really is the most beautiful one to take care of nausea or anything on this midline, like I just said. Nausea, uh, vomiting, reflux, coughing, anything cardiopulmonary. So let me go back to my case because what's beautiful about magic for midline, ooh, let me share that again. One moment here. Let's say somebody was complaining about urinary bladder incontinence, or my case is actually about excessive vaginal discharge. Well, where does that sit? What channels go through there? Ren, kidney, stomach. Ren, kidney, stomach. Everyone thinks vagina. Oh, okay, I'm going to think spleen and liver. That's Zongfu. But the channels that go there are Ren, kidney, stomach. Yes, of course, Chong too. So let's go to the case. Do we have time? Let's try. Let's try and go through it. Young 26-year-old female complains of vaginal wetness and discharge that is not around her ovulation time. Symptoms have been present for 3 weeks. Now the discharge is very foul smelling, cloudy, and wet, and the wetness wakes her up from sleeping. A lot of mucus discharge, and the patient has had a very stressful and demanding family life. This started after a cold, has had a lingering cold, and the symptoms started after the cold. It was a very productive cold or cough, yellow sputum, green in the morning, and a sore throat in the evenings. It got worse after a business trip to Florida. The mother also has similar symptoms, which I thought was very interesting. So what is your channel diagnosis? So we have excess vaginal discharge. And I'm asking for your channel diagnosis because I know all of you are going to see TCM and you're probably thinking damp heat, blah, 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 blah. Okay, that's great. Good. But we're looking at balancing the channels. So if we look at that, the vagina, I already said it's Ren, kidney, stomach that runs through there. Okay? Magic for midline focuses on balancing kidney and stomach. Perfect. So I actually want to use magic for midline. And actually, I can just move the points of the holography to now focus and point to the vagina. So let's go there. Let's just go to the map here. Let me go here instead here. So I will show you the holography in a moment, but let's just use your imagination with the points. So we have to move down towards more near the joint line of the wrist and the joint line of the foot in order to get the image of the puppet show. I'm going to just switch this just one moment here. Okay, let's go to the hand for a moment here. So we can imagine this is on the bottom third here. Okay, so that means I need to focus on the bottom third here. I can on the yin channel points, and that would mean I would focus on the bottom third of the yang channel points. Okay, so I want you to think about the bottom third towards the ankle and the wrist joint line. Now we're going to go back and we're going to write the points. So we know that magic for midline is PC, kidney, stomach, oops, not SI, stomach, and LI. So if I'm going to go now to the bottom third, okay, let me see. PC6 sits right there. Agree? It's very near the bottom third, near the wrist joint line. Okay, how about kidney? Well, kidney 8's around there, 7's around there. I encourage you, and I'll teach you this in class, we do a lot of hands-on palpation in the class, is to palpate and find the tissue abnormality. You will actually feel on the balancing channel tissue changes. Maybe it's not exactly at tissue 8, kidney 8. Maybe it's actually at 8.25. And that's still in that bottom third of the limb that is exactly a level with the image of the vagina. Then maybe that's where you needle and you put an A there. So that means stomach, maybe it's 40.75. You get what I mean by the decimal places, right? Because you know which way you're going with it. And that would mean LI, maybe it's 6, maybe it's 5.5. Now you have a magic 4 midline that is very focused on the lower part of the abdomen. I'll put very low abdomen focus. So I will tell you that with this patient after the first treatment, that her volume decreased by 50% when I saw them 2 weeks later already. So then we kept picking away to rebalance the body until it was all clear. And that happens often too. This is often what I will do with people that have interstitial cystitis or overactive bladder. For young people that overactive bladder, not an elderly person has an overactive bladder. And usually it takes maybe 3 to 6, maybe a half a dozen treatments, and then they're good. That's good. That's quick. That's it. So that was what I wanted to present to you for the level 2 multiple system internal medicine case. Let me just take a check here before I wrap up to see if there are any questions.
Thanks, Sonia. Yeah, so if anyone has any questions, again, pop it into the chat. So had a question a little while back. Are you familiar with a Taiwanese practitioner, Sonia, called Wu Guo Bing? He teaches a Bagua type of acupuncture. Someone was just wondering if it's similar at all to the balance system method or.
Oh, okay. I don't know that person, but I wouldn't be surprised if it's similar because both Chao Chen, Dasha Tan, Master Tong are from Taiwanese lineages, and Dasha Tan learned this from his family. So I wouldn't be surprised because if you know the history of the migration, you know that people would migrated outside away from China, took their knowledge, and established it in Vietnam and Taiwan. So they have classical knowledge that has lived on. So I wouldn't be surprised if it's similar. Yeah.
Great, thank you. Okay, so we got a couple of other questions that have come through. One from Stephen. How often would you treat a patient?
Ideally, okay, so that's always a hard question to answer. If it's acute, ideally I say if you can come twice a week, we're gonna get rid of this sooner, right? How many people can come 2, 3 times a week? But I usually say don't let it go more than 7 days. In the first initial stages, when I'm trying to recalibrate and reestablish a new body, or trigger the body to go back to normal. And then I'd say on average, the average case, if we're just talking musculoskeletal, things are usually come around in about 4 to 6 treatments. If you're treating internal medicine, usually at the 6 to 8 treatment mark for an average, not very complex case, then we can start to spread it out every 2 weeks. And I'm saying, it's hard to say what's an average, not complex case, right? Because there are definitely cases that are very, very complex, and I would not give you that average. Yeah.
Yeah, that's fair. I've got another question here. Someone's asking, can you explain why we don't poke the bear?
Well, who likes to be poked when they're sick? That's why. We don't like to be poked when we're sick. We're just going to get more angry. So if you keep doing local needling, you're poking the bear to aggravate it even more. Like, some people just want it left alone. And you know what happens when you're sick? This is what happens when you're sick. Oh, honey, can you get me this? Oh, honey, can you give me that? I'm too tired. Can you give me this? Can you give me that? Well, guess what Balance is doing? You're feeding the resources with the bouncing channel that's connected by some sort of bloodline and giving it the resources it needs to heal. That's what we're doing.
Nice. A little question on your book. In your book, do you describe the global balance at all?
Global balance is what I had just showed you as multiple system balance. It's also called, they're called the same thing. So global balance is the original name from Dasha Tan. I just call it multiple balance because you're balancing multiple channels at once. And you're going to use global or multiple balance anytime it's an internal medicine problem, anytime it's 2 or more channels that are sick, or you have a channel that the entire channel is sick or blocked, even including the pathophysiology.
Right. And then another question here. How about treating like an anxiety condition after like a big shock or something like that, with diagnosis of kidney and heart failing to communicate? So a little bit
Mm.
specific kind of case.
Yeah, so if someone's treating anxiety, if you're treating anxiety, and so heart and kidney failing to communicate is a Zongfu diagnosis. So if someone's coming in for anxiety, one of the first things I will say is, where do you feel the anxiety? Then I go to where they're feeling anxiety. I see what channels are blocked. And where those channels are blocked, I'm going to use the channels or the strategies I know to unblock that and create flow in that area so they don't feel that blockage and they don't feel that anxiety. Now, having said that, there are also channel patterns we use or strategies we use that also address psychospiritual or emotional or personality types to help kind of balance the edges of those. So because, sometimes anxiety is partly personality, right? It can be circumstance, it can be a little of both. So there are also those that we also learn and utilize as well. Hope that answers that question.
Yeah, that's perfect. I think probably similar as well. Somebody's just asked, treating shingles patients with nerve pain. Again, it comes down to like making that diagnosis, what channel's affected, and then
Exactly.
imaging. Yeah.
Yeah.
Um, Sally, I think you had a question that you wanted to ask. If you wanted to ask that, you feel free to unmute yourself, if that's what you wanted to do.
Hi, can you hear me?
Yep. Hey,
Yeah.
Sally.
Thank you. Hi. Yeah, I just got a book translated in Nanjing. I was studying there for 3 months in 1988. I've been there a 5 times now to study. And there was a Dr. Jing who we did some work with on ancient facial diagnosis and tongue diagnosis. He's since died. But I paid for a book to get translated that he had there. And I've never done anything with it. It's on very old Chinese paper. I've got to get it put onto a disc at some point. But he talks about the 6 channel theory with extensive diagnosis using tongue, face, but it's all
Yeah.
related to the 6 channels, the
Yeah.
timing and so on. And I just wondered if, would you be interested in looking at it? I need to get it put on a stick first and copied because it's just, as I said, it's on this really old Chinese paper at the moment. So
Yeah.
I just wondered
Yeah,
if
you'll
you'd be.
probably find some overlap in the foundations of this courses and some of the higher levels. I will say that I don't cover face diagnosis in the foundations.
Yeah, that was just an interesting book. I thought
Yeah.
might be.
Oh, definitely. It would be. Yeah. I want to read it now too.
Yeah, yeah, no, it was great, and he was a mate. We did a lot of lectures at night after hospital clinic time, and with him privately. So got a lot of detailed stuff from him.
Okay, good. Lucky
Like,
you. That's great.
the 6 channels for the diagnosis, and complex emotional conditions. It was really interesting.
Yeah.
Yeah. Anyway, thank you.
You're welcome.
This was
Thanks,
good.
Ali. Um, yeah, any other little questions coming through? You're welcome to unmute yourself. One thing that I wanted to sort of mention, and somebody mentioned in the chat box, is the idea of like the 9.75, or like you're
Yeah,
not restricted by the textbook location of points. You're actually
that's right.
you teach how to be very flexible. It's more
Yeah.
about the channels, right?
Yeah, because when you're on a channel, you hopefully you learn in school. If you're on the channel, you're still affecting the channel. And when you're doing like these decimal in between points, you are being more specific because you are trying to mimic what the body is telling you, the holography. Like people are not necessarily sick only on those points, right? There is space between that where there is. So, and I will say this, that the more specific you can be, the more clear the message. So then the body will get better. So it's one of the things that I like. I know that when Dasha Tan taught it, he originally just wanted to teach it, just use these points and use my clinical favorite points. And because he did a lot of study to say, I know these are the most effective. The problem that he started to run into is people didn't know how to do anything else but the clinical favorite points. So when I began to teach, because I knew that how much you could customize, because obviously I've learned a lot from him, I knew I wanted to teach that so people could be even more effective in clinic right off the bat instead of waiting and wondering, and they just have the more of the body of the work to start with. Yeah.
And yeah, one thing that I love about when we've had you out before is how sort of focused you are on like actually palpating and feeling for the changes. Is that
That's right.
something that you've really brought into like your teaching? Was that something that Richard Tan really taught, like palpating, or um,
He always spoke about it. He would always spoke about it, and he would, but he would say some people don't have good palpation skills, so you have to trust the image location. But because I used to be a kinesiologist, so I feel I'm very kinesthetic and was used to be in athletic training, so I felt tissue, manipulate tissue all the time. I think that's just who I am, right? So I knew, oh, you can actually really feel the changes, and by that, if I can mimic exactly location, get them right in there, I can be even more effective. And that's what I'm finding. So that's why I do that. So that's why the in-person, if you can take it in person, you're going to get more out of it because we are going to go through the palpation. We're going to go through the point location. You're going to learn new points. And you'll get the feedback of myself and my teaching assistant saying, yes, you got it. Hey, do you feel that? Feel this. Yes, that's the correct location. Yes, that's the correct depth. Yes, all of that. So I mean, in-person courses are really irreplaceable, right? Because it's an exchange of transmission of energy. And you can't, it's just not something you can do online.
yeah, yeah, I feel like yeah, that's such a powerful part of the actual live workshop, and yeah, we always really appreciate like how hands-on you get with the students. So yeah, that's
Yeah.
fantastic, and yeah, it's such a I mean, yeah, we love doing online stuff and accumulating knowledge, but I think, yeah, actually doing some
Yeah.
hands-on stuff is so needed for this kind of medicine in particular.
Well, you
I'm
do.
just,
And we're doing energy medicine.
yeah,
Exactly, right? You got to be hands on the body. You can't learn to drive in your head.
no,
You got to actually drive. You got to actually drive. So you got to actually put your hands to work.
yeah. We have had one other question come through. Do we need to manipulate the needles, like any particular sedating or tonifying techniques or anything like that?
Nope. Nope. As long as you get good Dutchie, that's it. You can walk away.
Yeah, nice.
Yeah,
Um,
easy, easy peasy.
yeah. All right. I think that's all the questions. Yeah,
Sure, yeah.
great. Thank you.
I can just wrap up. I mean, the wrap up is just a summary, and then of course, if people have questions after that, I'm willing to stay for however long people want. So, just as a little review, anytime you're going to use a multiple system problem or a global balance, problem, it's because pain is everywhere on the whole channel. Almost the whole channel is blocked. Or pain is on two or more channels and you want to be more efficient. Or it's a functional or an internal medicine problem. You always have to have two requirements, but if you use one of the pre-designed strategies, those requirements will already be there. One of the things to remember is that balance system acupuncture, classical acupuncture, is a channel theory based approach. It's a classical Chinese medicine system, not a traditional Chinese or modern Chinese medicine system. So you want to diagnose in an acupuncture or channel theory way. You got to get the Zong Fu hat off. You got to put it aside. And then you just come in and you just look at the channels flowing through the area. And then you're going to look at the most efficient choice for balancing. In Foundations, you're going to learn all the different 5 single systems to balance, but then you're going to learn how to put all the little alphabet together in a language that gives you pre-designed strategies and make it easy for you to get going in your clinic and be a game changer in your clinic. One of the things I actually just heard from a student said that when she started using this, it gave her a structure and a foundational framework that made it clear and confident for her in clinic. And then she also got results, which is a bonus. It's a win-win because you're getting results for the patient, you're getting results for yourself, right? So, and then your next step is you're selecting your points based on holography. I will tell you that most students have the trouble learning and memorizing the holography, but that's normal because there's a lot of maps we use, and as you use them more over time, you'll get to know them well. So just know that that is the trickiest part to get to know well, but we will have practice with that. These last 2 steps are 2 steps I added. This is Dasha Tan's three steps. Richard Tan. This is R Tan. This is S Tan. We're all Tans here. And so I added these 2 so that I could ensure people were the most effective. If you're treating for MSK, you want to chase until at least 50% is reduced, then you know you're on the right track, that you've chosen the correct, you diagnosed correctly, you've chosen the correct balancing channel, and you've chosen the correct holography. And then last one is also to establish better results, to let it flow for at least 30 minutes so the cycle of qi can flow through all channels, which is 29 minutes. Okay, so those are the things we will cover in Foundations. We've already come to the question and answer period, future considerations. I hope to see you in November. That's my time for today, but I'm willing to stay for as long as there's questions. I wanted to thank you for your time and attendance, and hopefully I'll get to see you soon.
Thank you,
Are
Sonia.
there any questions? More questions?
Um, Nothing else has come through. I just did want to add one more thing that I thought of,
Yeah.
because yeah, in recent years there have been like other people teaching the like balance method, and we've seen people are kind of like just teaching one system at a time. But over this workshop, you'll be teaching like the levels
Oh,
1 and 2
yeah.
together, which you've mentioned before is important to cover those together.
Yes, yes. I want, that's a very good point. Thank you for bringing that up, Gavin. So when Dasha Tan passed away, there's 3 of us that began teaching it. I started later teaching it because I wanted to develop my own curriculum, and I have a curriculum at a private school now with a mentorship program. But the goal is that I just needed time. And so the teachers will teach the content, but in different ways, and the content will be slightly different based on their own experience now and their own education and bringing that, So I think some teachers are teaching it really just, oh, you're only going to learn, say, level 1 right now over 3 days or something like that. Or they'll break it up into components and stretch it out longer. That's their choice. That's the way they found it effective. For me, I find the why I put the Foundations together is system 1 is the alphabet. Level 1 is alphabet, single systems. Level 2, the multiple systems, where you're learning internal medicine and you're learning 80% of the base strategies you're going to need in clinic, you're learning in level 2. So you're learning the alphabet and you're learning a base language. And that creates a great effectiveness to get you started, like 70, 80%. Otherwise, we're just you're going to be drawn out for months just waiting, like, when do I get to learn internal medicine now, right? And that's just something I know that I've refined it now to over 3 days, and over the last 5 years, and I find that this kind of package is the best to launch people with.
Amazing. Thank you so much.
You're
So
welcome.
yeah, thank you everyone for joining us. This has been recorded, so once I've had a chance to sit down and edit it and upload it and everything, we'll be putting it up on YouTube and we'll send everyone the link to review it because I think Sonia just covered so much valuable information and some like real like immediately applicable tips. So I'll be sure to upload this as soon as we can. Also, just to mention, I recently did a interview with one of Sonia's Australian students based in Tasmania, and he's really taken Sonia's teachings and methods and put it into practice, and that was really nice to hear. So I'll send out a link for that interview as well. But thank you again, Sonia. This was amazing, and we really look forward to having you in Sydney once again in November. And I've popped the
Yes.
link in the chat for anyone interested in finding out more about the workshop. Right.
Wonderful. Thank you.
Thank you.